Hello and welcome to this premiere edition of Tuscaloosa is Talking with Philip Coleman. I'm your host, Philip Coleman, and I'm so very honored to be able to say on this inaugural edition of Tuscaloosa is Talking, the doctor is in. Yes, the gentleman that you see on the right-hand side of your screen is Dr. Vernon Scott, MD of Tuscaloosa and all of West Alabama and surrounding areas. Dr. Scott, thank you so very much for taking time from your always very busy practice to join us for this first edition of Tuscaloosa is Talking.
Glad to be here, Philip. Thank you, and thank you for creating this platform. I'm sure that others will also welcome the opportunity to show up.
Well, thank you very much. And Dr. Scott and I are going to be discussing something that all of Tuscaloosa should be talking about and elsewhere as well, and that is the prevalence of the occurrence of prostate cancer among the general male population, but in particular among the Black American male population. And despite the prevalence of the occurrence of prostate cancer among all groups of men, still many men are highly reluctant and put off taking that very important and potentially life-saving prostate exam because they think it's still that same old highly physically invasive, fear the finger, pardon me, prostate exam from many years ago. But today, as we recently learned in a brand new public service announcement or PSA that I heard just a few weeks ago during the Super Bowl, that launched that brand new public service announcement in which they launched a new catchphrase that we're focusing on today: relax. It's just a blood test. And that's what Dr. Scott is going to explain to us, that highly dreaded but yet potentially life-saving prostate exam today is just a simple, unintrusive blood test. Am I right, Dr. Scott?
Philip, that definitely is a key component. PSA really was introduced about the time that I was really graduating and starting my medical practice. Over the years, it has had to become legitimated. And I think that that's why you're seeing it launched to the public. But it is definitely a very important arm of investigating and diagnosing prostate cancer. And certainly, I can say about 99% of all men that I have diagnosed over my near 50 years of practice, PSA has been the guiding point that has said whether an investigation should proceed or if a person doesn't have any concern associated with how that value comes in as a spokesperson. I tell my patient it is the witness for the health and wellness of the prostate. So we use that witness for the power that it has earned over the years, because at one point it had to grow up in the medical community and establish its legitimacy. And we all agree now, because again, the extensive and malignant, very advanced cancers that were at one time very common are now rather infrequent.
That's always good to hear that that type of progress is being made with battling this insidious form of cancer. And now that it is a simple blood test, and we can't stress that enough because that's one of the points of our discussion here today is letting all men from all ethnic groups, races, ethnicities know that the prostate exam today is just a very, very simple, short, simple, easy to do blood test that is just something that should be done at least once a year during a gentleman's yearly medical exam. Is that how often men should have that prostate exam, that simple blood test done?
When it's used as a screening method, yes. Certainly, when it's used as a diagnostic tool, meaning if a man has been treated for prostate cancer and is under surveillance, to see if the cancer is attempting to return, there may be a different frequency of testing in that setting. But yes, as a screening tool for healthy men without a diagnosis of prostate cancer, annual PSA, um, generally starting in African American at age 40, at least a 10-year window lead time as opposed to recommendation for European other ethnic groups that is recommending started at age 50. So the thinking is that men who are of higher risk category should be under more intense scrutiny and therefore should have a longer lead in time so that if cancer is afoot, if it is getting started, you'd have the best opportunity to run into it once it is in its very early stages. That is the lead in times of benefit for those individuals who may be at greater risk.
Dr. Scott, I'm so glad you brought it up because you anticipated one of my next questions. In fact, the viewers may have seen me looking down at my notes, and that question was, what age? And you have just addressed that. I'm so glad you did. What age should a man come in for that prostate exam? And to repeat what you just said, African American gentlemen should start at the age of 40, and other population groups, such as those of European descent and so forth, should start at age 50.
Yes, sir.
And aside from getting that all-important prostate exam, which we can't stress enough during this discussion, are there any other early warning signs that men can look out for? Um, any other sort of changes they may observe in their bodies, or what their body is doing aside from the prostate exam itself? Are there certain things that might be going on with the male body, how the male body functions, that might indicate that there might be something going on that you need to have your physician or other qualified professional healthcare provider to look further into?
There are about five key warning signals, Philip, that we are conscious of. None of them are diagnostic, meaning all of them are associations. They are associated with men who are diagnosed with prostate cancer, but they can also occur frequently in individuals who are not found to have cancer. But we group them into five. There are five different things that that they come on the radar. Number one, it would be a change in the urinary volume and caliber and size. The stream may become weak, difficult to initiate. It may become less forceful. That is a sign that a change has occurred associated with the prostate. Blood in the urine is obviously in the urine or the ejaculant, the semen. Either one of those would rank a little bit higher up in terms of its potential risk. So certainly blood always gets higher ranking in terms of your consideration of something that could be potentially very serious. So other things are sometimes erectile dysfunction or pelvic pain or pain in the back, uh, um, um, difficulty ejaculating. So all of these can be symptoms that let an individual know their prostate is changing or that something is different about the way their anatomy works. So it gets our attention like anything. It doesn't give us a diagnosis and it shouldn't put us in hyperdrive in terms of our anxiety, but it should, if you don't have a primary care doctor, or if you do have a primary care, that you should then want to investigate. And when
I
you're doing
see.
the investigation, you want to have the best individual that can help you launch the investigation and try to come to the understanding. So these symptoms, like I said, they can also occur in other things. They could be signs of just an enlarging prostate, referred to as benign prostate hyperplasia, BPH. The prostate, once we turn age 40, and it kind of awakens and starts to enlarge. And that's just a general feature in men that the prostate will usually it's about the size of a walnut about that time when you're in your third and on up into your fourth decade of life. But it can grow to the size of a plum, even a grapefruit. So it can get very large and that can be not driven by cancer, a benign process, but an obstructive process that will have a burden on the individual in terms of the misery it can cause associated with voiding, emptying your bladder. But it is not threatening in terms of your health. And we'll talk a little bit more when we get to focusing on cancer directly itself. But if right now prostate cancer is the leading cause diagnosed cancer in men, aside from skin cancer. Prostate cancer would be the second, or the leading diagnosed cancer in men, but it is not the leading killer. It is not. Many men with prostate cancer would die of other things. They would die with the cancer, not due to it.
I see. And Dr. Scott, I have heard that as with most other cancers, early detection can be key in the successful treatment of prostate cancer. And that is to be vigilant, to look out for those warning signs that you just listed. Look out for those warning signs. And of course, going in as we are emphasizing understandably over and over again during this discussion now, going in for that important prostate exam because early detection, catching it early is key to having a successful survival rate and successfully treating prostate cancer. Early detection is key.
For sure. And also, many times treatment can be associated with functional impairment or symptoms difficulties itself. The more early the early the cancer is detected, the better your option in terms of how it should and could be treated to try to guarantee that the individual is out of harm's way, that they're cured of the cancer. So early detection allows you more flexibility and option. Those options can be associated with fewer side effects, fewer resulting difficulties as a result of the treatment itself.
And Dr. Scott, let's move on, if you don't mind, to the treatment of prostate cancer. Once it has been detected and the patient has been diagnosed as having prostate cancer, what are the options for treatment, for the successful treatment of prostate cancer? I understand that there are choices, there are options. It's not just a case of one treatment is for everyone, but there are options as to what type of form of prostate cancer treatment might be best for the particular individual that has been diagnosed.
Correct. The most commonly used right now is radiation treatment and surgery. Those are the most common approaches, but there are other proton, electron therapy, thermal therapy, where they use heat. Um, uh, but again, the most common are radiation, where X-ray is in a controlled fashion delivered to the prostate in order to destroy the cancerous cells. Certainly over the years, radiation has become a better, more like a surgical tool because they can control the beam, the delivery process. They can control the delivery so that it doesn't have as much scatter. It's more like a rifle than a shotgun. We've moved from the shotgun era associated with radiation. Now it is that does a lot to reduce the impact of good tissue that's in the neighborhood that was getting hit just simply because you were going after the prostate. So radiation is, and even men can have radioactive material deposited into the prostate itself in the form of pellets, and they stay there permanently, and they release radiation gradually into the environment, and that is very successful in destroying cancer. So the approach is tried to be is suited to meet the need of the individual in terms of how they are profiled and they with their cancer. So each individual, as you were just saying, is no one fit one treatment for everybody. So you have to profile each individual, and each profile then has a evidence proven type of approach because that's the way everything tries to make sure that there's going to be a good outcome for the patient is to have sufficient evidence that tells you this is best practices associated with getting a desirable outcome for this individual. So again, keep in mind that the earlier the cancer is detected, the more that desirable outcome is likely to be assured with fewer potential complications.
And after a gentleman has gone through a prostate cancer treatment, whether the radiation technique is best for him or whether the all-out surgical technique is best for him based on his particular individual circumstance, can one expect to have a full return to normal activity, normal functions in the patient's daily life?
Well, clearly those things are definitely on the out front when I think when the team is trying to decide how to approach the individual. The hope is that you don't leave them deficient in any functional way. So again, if you've got early detection, again, here you have options. But where surgery is involved, there is the opportunity now to be more specific so that you can avoid, again, collateral damage to nerves and vascular structures that are all important to how the functional capacity of the um, penile genital works. So trying to leave those all important uh, uh, functioning features in place is key to how you try to get to the disease prostate and make sure that you are successful in achieving a surgical, a good surgical option there. So yes, the intent is always to leave the individual with capacity and function that they had, no less than they had then once the process was started. But there will be a period of remodeling. Things have to remodel. They have to heal. There is going to be some burden there for some time, and some people heal in a way that, again, they have a certain level of function, and others may have other kinds of things that can sometimes, if you got diabetes or other kind of conditions and things, sometimes those things can affect how much can be achieved in terms of getting that person to a more functional level.
I understand. And Dr. Scott, again, with prostate cancer, unfortunately being so common among all population groups, once again, no matter what your race, ethnicity, national origin is there something that men can do to maybe at least reduce the likelihood of the occurrence of prostate cancer in their life. But, is there certain dietary factors, what we eat or what we don't eat, a healthy, reasonable exercise program? Are there certain forms of activity that men can engage in that might lessen the potential of prostate cancer to develop in their body?
Yeah, that's been the age-old question there, and nothing is known as a magic bullet. Nothing is known that has that kind of proven power. But there are things that can work toward the outcome. That is, if a person engages in activity to keep their physical body as well as it can be, don't participate in use of things that may be detrimental to the body, tobacco, alcohol in excess. Uh, Keep a physical regimen. The body is a machine. It's a machine. And like any machine, it has moving and working components. And those components are best preserved and best maintained once they are in use. So keeping physically active and keeping a healthy weight, keeping a healthy weight, working to maintain it if you don't have it, working to achieve it if you don't have it. If you have it, working to maintain it. These activities are just good universal. They're universally good investment. And I think in that environment, if cancer becomes something that is on the radar, no matter, I think, what organ it may tend to be, that that's a better fighting machine than when there are so many other things that also can enable the disease process to try to be more challenging. So I think just having, and certainly we do know that um, um, raw vegetables, fresh fruit, a Mediterranean diet has been proven to be very useful there. So certainly looking into measures like that has been asked, well, with frequent ejaculation, do anything to reduce it certainly may reduce the size of the prostate, but there's no guarantee that it will reduce the frequency of cancer. And there are many people who will sell you a bill of good, whether they call prostate health or whatever. They can offer you more than they can deliver. I'd be careful about investing in things like that. But certainly, keeping a healthy weight, trying to age as healthy and as free of disease as you can.
Yeah, you bring up such a good point, Dr. Scott. I'm so glad you brought that up because just in my regular TV viewing, I notice ads for certain products for allegedly, and I choose that word very carefully, allegedly are for prostate health. And as you just encouraged our viewers to do, to be diligent about such advertisements and to beware of anything that they see in a television commercial that claims to be, beneficial to the prostate. If you come across such a product that you want to try, invest in, I think it would be wise for that person to check with their physician, their qualified actual medical doctor or other appropriate professional healthcare provider before they invest in some of these so-called prostate products that they may see advertised on television.
Agree.
And it's just sort of a sad fact that I have heard in my life that almost if any man lives long enough We all want to have a long, healthy life cycle, a lifespan. But I have heard that if any man lives long enough, most men can expect to be diagnosed with prostate cancer at least once in their life. Uh, if that is true, that is just further encouragement to use that word again that I just used a few moments ago, to be diligent in monitoring your own health, getting that prostate exam done uh, in a reasonable amount of time when your physician recommends that you do so, and to engage, as you have just done, Dr. Scott, in have everyone to engage in a healthy lifestyle with exercise and healthy eating, and just make sure they just stay on top of this situation to do what all we can do to lessen the occurrence, the likelihood of prostate cancer development within our own bodies.
No doubt, no doubt. And certainly, fortunately, the majority of prostate cancers are indolent, slow growing. And like we said earlier, most men will die with the cancer, not due to it. The more aggressive cancer tend to occur, the more younger population. Again, that's why the lead time in terms of men, African American in particular, and other high risk men should be screened earlier. And as you said, that process should be vigilant and continue on throughout life there, so that if an aggressive type of prostate cancer were in the offering, were to occur, it would be detected early, and the options for best treatment and fewer potential risk and side effects would be afforded to that wisely invested individual.
Well, Dr. Scott, I want to once again thank you with all sincerity for taking the time to be with us for this all important discussion. And I really can't thank you enough for kicking off what we hope will become a regular program. Tuscaloosa is talking. But thank you, Dr. Scott, in particular, for getting us off to such a terrific start for our viewers for this new program.
Philip, thank you, and thank you for your vision for the community there. We look forward to it. We believe that it's going to be the spark that can lead to other things. So we're here and we support you, and thank you.
Well, that means the world. Thank you so very much. And also, I want to thank our viewers as well for sharing their precious time with us and joining us for this program. And something I'm going to have to get used to saying if this program continues on a regular basis, and I certainly hope that it will, be sure to like, share, and subscribe to help lead to the continuation of this program. And so, again, thank our viewers for joining us as well. I appreciate you sharing your time with us. I also would like to publicly thank my beautiful wife, Michelle, for serving as producer of this program. She has handled all the technical aspects of this program exceptionally well as we learn this new technology called Zoom. I want to publicly praise her and thank her because she deserves it for making this program possible as well. So thank you, Michelle. And once again, thank you, Dr. Scott. Thank you, Mrs. Scott. And thank you, our viewers as well. And we hope to see you again soon in the coming days with another edition of Tuscaloosa is Talking with Philip Coleman. Thank you.